Good afternoon, everyone. We'll get started in just a moment. All right, well, welcome and good afternoon, and thank you for attending today's seminar on the impacts of climate change on environmental public health. My name is Nicole Dutra-Marquez. I'm a senior project coordinator for the National Environmental Health Association, and I will be moderating the seminar today. The agenda for today's seminar includes a quick overview of who is NEHA, where I will provide some insight to our organization and our role in environmental public health. Next, I will introduce our guest speaker, an expert who will speak to you on the impacts of climate change on environmental public health. Following his presentation, we will move into our panel discussion with 3 environmental health professionals who will share their experience working in the field. Lastly, I will share with you some information about NEHA's 86th Annual Education Conference. Allow me to cover a few housekeeping items before we get started. Please note that this webinar is being recorded. The recording will be uploaded onto the NEHA website at www.neha.org. We will take a few questions upon completion of our guest speaker's presentation and later during the panel discussion. Please feel free to drop your questions into the Q&A box during both of those. At the conclusion of the seminar, you will receive a link to take part in an evaluation where you'll be able to provide us some feedback and comments on today's seminar. With that, let's begin our seminar. Before we talk about who we are, I wanted to take a moment to talk about our profession. While many don't recognize it, environmental health is the foundation of public health. As you can see from the World Health Organization, nearly a quarter of deaths from around the world are due to health risks in the environment. Environmental health refers to protecting humans from health risks that come from the environment, such as pollution in the air, contamination of food at a restaurant, or lead in a water source. Environmental health is also one of the 3 legs in disease outbreak. It takes all 3 professions to prevent and reduce outbreaks to protect public health. As an association, everything we do is to build, sustain, and empower environmental health professionals so that they are equipped and prepared to protect the health of communities across the country. Our most recent membership survey revealed that most of our members are working directly with communities at the local level. The survey also illustrated that our members serve all types of communities from really small to very large. This map illustrates the reach of our fiscal year 2022 projects throughout the country. We supported and partnered with jurisdictions on 768 projects. To support the workforce, we also invest in environmental health via funding from the FDA and CDC on topics from food safety to land reuse. In fiscal year 2022, we invested nearly $10 million. Some examples of these investments include support for jurisdictions participating in the NEHA FDA Retail Flexible Funding Model Grant for food safety, scholarships for the Leadership Institute, funding for tribal entities and U.S. territories to build their environmental health infrastructure, specifically around childhood lead exposure, disaster relief, and vector control issues. And we also provide many grants for health in all policies. Part of how we support public health overall and environmental health specifically is by continuously providing training and education and offering credentials to certify the expertise of our workforce. In addition to our large online library of courses, webinar recordings, and resources, we host an educational conference every year that includes 14 different tracks from leadership to response, emergency response, body art, communication. This year, we will be in New Orleans. We have a team of instructional designers who build online and in-person trainings and instructors who deliver courses to provide the latest in research and practice to our workforce. We also provide field training in the Pacific Islands. We offer 6 credentials that certify expertise of all facets of environmental health, as well as specific aspects of food safety practice. We advocate for funding and policy at the federal level for the environmental public health profession specifically, and public health generally. We also provide our members with regular updates on relevant national and state legislation through our webinars and blogs. We believe that part of building and sustaining our workforce is to provide opportunities for professional growth at many levels. We offer scholarships and internships to students studying environmental health sciences, and the first ever Environmental Health Leadership Academy for professionals already working in the field. Much of our work is connecting the right people together and serving as the lead or support to set and meet goals that serve the profession and environmental public health. A few of our communities include the Private Water Network, Climate and Health Community, Concurrent Disasters Community of Practice, and the Environmental Health Strike Team Standard Community of Practice. For our members, we provide an online social platform we call Community. It allows members to connect with each other, ask questions, and get tips. On the platform, we offer events like the quarterly 30-minute leadership presentation called Spark. And we're just launching an Ask the Author pilot for members to ask questions and hear more from a featured author in our Journal of Environmental Health. We provide anyone who would benefit from the research, education, advocacy, and connection we provide for the environmental public health community. You can learn more about it at www.neha.org. Now let's get to our topic on climate change. Our guest speaker today is Dr. Amir Sapkota, who's a professor and chair of the Department of Epidemiology and Biostatistics at the University of Maryland School of Public Health in College Park, Maryland. He received his PhD from Johns Hopkins Bloomberg School of Public Health and postdoctoral training from the International Agency for Research on Cancer in Lyon, France. His research focuses on the impacts of climate change on human health. Currently, he is leading a multinational consortium to develop an early warning system for diarrheal diseases in the Asia-Pacific region. Dr. Sapkota, please go ahead with your presentation today.
Great. First and foremost, thank you, Nicole and Chris and Neha for extending this invitation for me to talk today. Let me share my screen first. Okay, can you see my screen?
Yes, maybe maximize your screen.
Yeah, can you see
There
it?
you go. Yep, perfect.
Great. So, like Nicole said, I am interested in studying the impact of climate change in human health. And since my directive is to talk for 15 minutes, I'm going to actually jump right away into this. So let's look at a couple of news headlines. And I'm going to go back all the way to 2003. And that was the year there was a massive heat wave in Europe. And I don't know how many of you remember that. And the BBC headline that year, that summer says, Britain, that was the hottest day ever recorded in Britain. And England is a country that has been keeping track of temperature for really long time, hundreds of years. And so that was 2003, hottest day ever. Again, headline on 2006, 2015, 2020, and all of this talking about the record being broken, the hottest temperature record being broken in UK, not in any other countries, just in looking at United Kingdom. And the same thing that I'm going to come back closer to home and talk, looking at a headline from Washington Post, and this is talking about extreme precipitation in area right around the Baltimore-Washington International Airport. So those of you who are not familiar, it's an international airport located between DC and Baltimore. So once in a 1,000-year rainfall event in that was in 2014. Again, to 2016, same exact area, once in a 1,000-year rainfall event. Again, 2018, once in a 1,000-year rainfall event. And I'm not talking about different state or different city for that matter. I'm talking about the same exact location, where BWI airport is located. So what is happening? First and foremost, if these events, sort of like once in a 1,000-year events, are happening every 2 years, they're no longer once in a 1,000-year rainfall event anymore, right? So the definition by which we define that once in a 1,000-year event is out through the window. And this is what the climate scientists have been telling us, is that this type of extreme event, whether you're looking at a heat wave, cold wave, or extreme precipitation, they are becoming more frequent, right? So we are seeing more and more of them. And not only that, the most recent IPCC report also states that this type of extreme weather event will continue into the foreseeable future, even if we are completely successful in mitigating the greenhouse gases right now. And that is because of the changes that have already taken place, right? So this is what troubles me the most. And so because that begs a question as to how on earth are we going to adapt to this new set of hazards as a society. We don't have a choice, right? We must learn to adapt to this, because we will continue to see these extreme weather events. And the impact of such extreme weather events, obviously, there are direct impacts, such as drowning from flooding related risk, or dying from heat wave, heat exhaustion. So those are what we call direct impact. But there are also indirect impact of climate change, right? So you can think of if the warmer wintertime temperature, for example, what that does is that pushes that enhances sort of like the timing of spring onset, right? So trees start to bloom early. Well, what does that mean? Tree blooming early means the pollen season is starting early. So if you happen to be somebody suffering from allergy, or hay fever or asthma, that's not a good news for you, because the pollen season is starting early, meaning now the length of pollen season is longer, right? So that is an example of indirect impact of climate change. You may also think about mosquito habitat, right? So with the warming temperature, mosquito habitat is expanding into higher altitude, colder climate, right, where there were no mosquitoes before. But because of the warming, now mosquitoes are the geography is expanding. So that means vector-borne diseases such as malaria, dengue fever is now more common in the hilly regions of Nepal. So that is an example of indirect impact. So when we are talking about this, we always think about, well, who's more vulnerable, right? So the question of vulnerability comes in. And so just to take a brief step back into this. So who is vulnerable? Well, that is determined by several factors, right? So one is, people who are disproportionately exposed to that risk are considered to be more vulnerable. So if you are thinking about flooding related risk, people living on the low-lying area, or living close to the coastal area are more at a higher risk. If you're talking about heat wave, people living on the urban city center, because of the urban heat island effect, they are disproportionately exposed, so they are more vulnerable. People who lack capacity to adapt, right, are also considered to be more vulnerable. What do I mean by that? Well, if there's a heat wave, the first one to die from heat wave are not people who are living in a home with a central AC, right? So it's generally people on the street who are the first one to die. And after that, it's people living in a row home whose electricity has been turned up because they haven't been able to pay the electric bill, right? Or are afraid to turn on their AC because they are, that they're worried they may not be able to pay the higher electrical bills. So those are more vulnerable. And then there's also people who are living with existing condition, right? People with diabetes, people with heart diseases, asthma, they're considered to be more vulnerable. So let's take a look at one such group, and that is people living with chronic kidney disease, right? So or end-stage kidney disease, ESKD. And these is sort of, ESKD represents the final stage of chronic kidney disease, where basically your kidney has stop to functioning, right? So you have a kidney failure, and at that stage you either have to get new kidney transplantation, or you have to undergo dialysis, which is generally administered 3 times a week. Well, it turns out that when there's a heat wave, healthy people can cope with the increases in temperature by drinking more liquid. But if you happen to be undergoing dialysis, you cannot do that because your liquid intake is strictly regimented. So people, ESKD patient, those that are going under dialysis are considered to be sort of like canary in the coal mine. They're extremely vulnerable. So my former doctoral student, Dr. Richard Remigio, did this study where he looked at hospitalization and mortality risk among end-stage renal disease patients. These are, patients that are undergoing dialysis. And these people were in Boston, New York, and Philadelphia. So he was basically interested in knowing what happens to the risk of hospitalization and death in people undergoing dialysis in response to heat exposure, like heat wave, right? So what he saw was that after extreme heat event, after exposure to extreme heat event, the risk of a hospitalization among this dialysis patient went up by 36%. That's a 36% increases in risk of hospitalization after exposure to extreme heat event. He also observed 32% increases in risk of death among this, end-stage renal disease patient after exposure to extreme heat event, right? So what was more interesting was that, so in the overall population, the increases in risk was 32%. But if you look across different, break that down by race and ethnicity, the Hispanics seem to have a lower risk, but non-Hispanic Black had almost 55% increases in risk of mortality, risk of death after exposure to extreme heat event. And he also looked, further broke it down by existing comorbidities. So say, for example, if you happen to be undergoing dialysis and then you had congestive heart failure, your risk increased by 52%. But if you were undergoing dialysis and you also had diabetes, your risk increased by almost 82%. So although the exposure is exactly the same, in this case, extreme heat event, the risk of death differed by race and ethnicity, but it also differed by other existing comorbidities, in this case, congestive heart failure, COPD, or diabetes. I want to also give you an example of another study where we look at risk of heart attack after extreme heat event. And this study was done in Maryland. So what we see in this study is that exposure to extreme heat event increased heart attack, hospitalization for heart attack by almost 11%. But if you break that down by race, in this case, non-Hispanic white versus non-Hispanic Black, non-Hispanic white have like 9% increases in risk. But if you look at non-Hispanic Black, the risk is almost 27%. So 3 times higher risk, although exposure is exactly the same. So when you see this type of data, the next thing that comes to mind is then, okay, so then, communities with a higher percentage of minority population should see higher increases, higher risk of hospitalization for heart attack during extreme heat event, right? So this map here this is a map of Maryland, right? Census tract in Maryland. This little white thing right here is Washington, D.C. And right outside Washington, D.C. is this county called Prince George's County, right? So the red color represents the census tract that are minority majority. In other words, they are, like almost all the population on those census tract are minority population. Higher than 80% of population are minority population. All right, so this is Prince George's County right here, and this is another concentration, high concentration of minority population in Baltimore City right here. So that represents Baltimore City. So, if this difference is true, then it's fair to assume that, you would see higher risk of myocardial infarction after extreme heat event in Prince George's County right here in Baltimore City because they have higher level of minority population. Is that true? That was what we are interested in. And the answer is resounding no. Like, well, if you look at Baltimore City, the risk is almost 43%. Very, very high risk of hospitalization for myocardial infarction after extreme heat. But if you look at Prince George's County, the risk is 6%, although there's a very high concentration of minority population. So what is the difference here? So the differences between Baltimore City and Prince George's County is, first of all, the minority population in Baltimore City are predominantly African American, whereas in Prince George's County, it's a mixture of Latino, Asian, and African American, right? So that's one difference. The other difference is the African American population in Baltimore City are living in abject poverty, right? So whereas the African American community in Prince George's County are the wealthiest in the nation. In fact, Prince George's County is known as the wealthiest African American county in the entire country, right? So this is, goes to show that yes, the hazard is exactly the same, but then there's this other layer of complexity that, makes what area are at higher risk versus other area that are at lower risk, right? So you can't just really just use one size fits all approach. So these are what we call, so you're getting into the social determinants of health. So that was chronic disease, and now I'm going to switch gear and quickly talk about infectious disease for a few minutes and focusing on diarrheal diseases. Right. So as you all know, being affiliated with the environmental health field, open defecation is a major problem, particularly in the low and middle income countries. In fact, countries in the Asia, South Asia and Africa are notorious for high prevalence of open defecation. Well, that's as a environmental health scientist, that you are worried about that because that fecal matter carries a lot of pathogen, bacterial and viral pathogen, right? So when you defecate in open like that, and then you have extreme precipitation, this is this type of situation that you end up in. And this is a picture of 2019 monsoon in Nepal, where like the entire area is flooded, right? But this also happens to be area where people do not have access to clean municipal drinking water, right? So most of people get their water from river, lake, and unprotected well. Well, when there's extreme precipitation like that, those are all contaminated with the fecal matter, right? So that's what enhances the fecal oral route of exposure and increases risk of your diarrheal diseases, among many others. So one of my students looked at, how this monsoon anomaly and large-scale weather phenomena such as ENSO impacts diarrheal disease burden in Nepal. And this is looking at overall entire country Nepal and separated by plain region, hilly region, and mountain region. So what happens is, like in Nepal, during monsoon season, that diarrheal disease goes up, the risk of diarrheal disease increases by almost 21%. And climate change is also now influencing the onset of monsoon, right? When does monsoon start, when it ends, and the duration of monsoon. So we were interested in that. So what we observe is shorter monsoon duration also increases risk of diarrheal diseases. The amount of rainfall during monsoon also increases diarrheal disease risk. But then are also this other large-scale weather phenomena such as El Nino, La Nina. Right, during La Nina year, the risk of diarrheal disease increases in Nepal, whereas during El Nino, it decreases. So why am I talking about this? Just to wrap it up, like to come back to the point that I made early, IPCC conclusion is that such extreme weather event will continue to increase in the foreseeable future because of ongoing climate change. So how do we adapt to these threats as a society? So what we are arguing for, and then, by that, I mean, public, a lot of folks in public health now, we're starting to argue for early warning system for public health adaptation. right? So these are early warning that allows us to prepare for these threats ahead of time and respond to it. But the shortcoming of current early warning system is that they are very, they don't provide you much lead time. It's like few days, right? Well, as a somebody working in public health, it takes lot longer to mobilize public health than few days. Even if you were to for example, implement a rotavirus vaccination campaign, right? That requires a lot of resources and preparation. So that few days warning is not adequate. So what we are arguing for is early warning with seasonal to sub-seasonal lead time, and by that I mean months, like 30 days to 90 days, or even like a 6-month lead time. Fortunately, there has been some really exciting development in the S2S, the sub-seasonal to seasonal weather prediction. And they are not absolutely accurate at this point, but I think they give us enough to work with. And the fact that, like I showed you in the earlier slide, these type of infectious disease also depend on this large scale weather phenomena such as ENSO, that can actually be predicted year ahead of time, right? So with this, we can actually start building early warning system. And this is what we are working on. We're developing this early warning system for diarrheal disease using machine learning, focusing on the Asia Pacific region. We have 6 or 7 different countries involved on this. And we are starting to produce this early warning with almost like 3 to 6 month lead time. We don't have data quite yet on how good these are. Like, we have to wait and sort of like validate that against what's happening. But right now we have started to produce diarrheal disease forecasts for summer of 2023 and fall of 2023. So we have publication that's coming up in this sort of like gets into that. So this is for Nepal, different variable adding different the sort of data enhances the accuracy of those early warning system. And we have also just published commentary on this Nature Reviews arguing for similar type of early warning system for dialysis patient too. Because if you happen to be undergoing dialysis and there's a hurricane and that wipes out electricity, that's a difference between that could increase your risk of death, right? Because not getting those life-saving dialysis treatment for a long time certainly increases your risk of death. So we are working with folks in Renal Research Institute about developing such early warning system for a dialysis patient as well. And I will leave it at that. I know I might have run a few minutes late. Thank you. And I will stop sharing my screen.
Thank you, Dr. Sapkota, very much. We will go ahead with any questions for Dr. Sapkota. So please use the Q&A box at the bottom of your screen to drop your questions in. Looks like we have a question for you, Dr. Sapkota. Are there any other environmental health or health issues that can indirectly result from extreme weather events?
Where to start, right? So certainly, the thing that comes is when you have flooding, then there's increases in mold exposure, right? So that's the one that we talk about a lot. But also, extreme heat, when there's, when extreme heat also increases ozone pollution, right? So if you think about it, ozone is a secondary pollutant that's formed primarily in this hot weather, right? But from reaction of oxides of nitrogen and VOCs. So the warmer temperature enhances the ozone production. So you tend to see higher ozone concentration, particularly in the summertime, for precisely that reason. So when the temperature extreme heat, the heat wave, the ozone certainly concentration tends to go up. So those are some of the examples.
Great, thank you, Dr. Sapkota. Another question for you is, what is being done for vulnerable populations against extreme weather, or what should be done?
So I think it's really about, you know, anticipating these things ahead of time, right? So, for example, one thing that a lot of cities are starting to do is this um, code red heat alert, right? So, just giving an example of Baltimore City, when there's a heat wave forecasted, the mayor's office, issues this code red alert system, and that initiates this whole mechanism by which, the emergency department, the police, the fire department are coordinate their effort, and you open up these cooling centers, YMCA's, libraries, other community centers stay open, providing cold, so particularly for people who don't have access to cool environment, those people that are on the street or don't have AC at home can go to those places to get respite from those heat exposure, right? So that's an example. And because if you look at the heat wave that we saw in Pacific Northwest this past year, and who died during those really hot Pacific heat wave, it was really people that were living by themselves, and people living in a house that did not have air conditioning, right? So those are extremely vulnerable. So providing that sort of respite helps. Those cooling centers certainly help. So that's one of the example that what you can do.
Great. Thank you, Dr. Sepkoda. One more question for you. What are the short-term and long-term impacts of climate change?
So short term is obviously what we are seeing right now, right? So increases in extreme heat, increases in extreme precipitation, increases in drought, right? And going from that drought condition in California to the other extreme, right? So this is, like weather's getting super erratic, right? So this is what we talk about, the increases in variance. So in some areas the temperature may remain the same, but the it gets a lot colder and a lot hotter, right? So those are sort of like the short term, situation that we are dealing with right now. But those are not, those are sort of like the ones that are talked about the most. But it's also having an impact on the timing of monsoon onset, forest length of forest fire season, right? And so those are also changing, and particularly the changes in timing of monsoon onset is very problematic in the in agricultural community that rely primarily on that monsoon rainfall for their agriculture, right? So you can only plant rice in a certain time, right after the monsoon arrival, right? But if your monsoon is completely shifting, you cannot plant rice in India in, like, for example, in August and expect to harvest that rice. Doesn't work like that, right? So it's throwing a monkey wrench in the entire agricultural productivity. So those we don't hear about a lot, right? So because those are not as obvious as seeing somebody dying from heat wave.
Yes.
So
Great. Thank you so much, Dr. Sepkoda, for all the information you have shared today. I do need to move on to the panelists, but Dr. Sepkoda, there is another question in the chat box, if you wouldn't mind replying in the chat. Thank you so much. All right, we will go ahead and move on to our panel discussion with Jenny McAdams, Dr. Jamie Donatuto, and Rad Cunningham. Jenny McAdams is the Sustainability Supervisor for Franklin County Public Health. Her work includes focusing on climate change efforts, lead and healthy home programs, and working with the solid and infectious waste team. Dr. Jamie Donatuto is the Community Environmental Health Analyst and Program Manager for the Swinomish Indian Tribal Community located in Washington State. For 17 years, she has been enacting investigations on behalf of the tribe, including researching toxics in local traditional foods, tribal health, related impacts from climate change, launching an environmental health education program, and developing community-based Indigenous health indicators. Rad Cunningham is a senior epidemiologist at the Washington State Department of Health, who manages the climate and health section. He is a public health leader working to improve lives and reduce health disparities by building public health into policies, projects, and programs. His values are relationship building, evidence-based public health and practice, and equity. Now we will begin the panel discussion. And as a reminder, if you have any questions for the panelists, please use the Q&A box that's located at the bottom of your screen. Great, so we will get started. Jenny, I will start with you. How did you get started working in the climate health field, and what are your current roles and responsibilities?
Thank you so much. And hello, everyone. Thanks for having me. I think mine was probably a little bit circumnavigating. So initially, I took a little bit of a roundabout road in public health. I started as the accreditation coordinator. And honestly, our public health department didn't have a climate and health field at the time when I started in 2014, as I'm sure a lot of probably didn't at the time. And from there, I was the community engagement and health promotion supervisor. So as I was part of that community engagement and outreach team, simultaneously in 2016, our statewide public health association was actually starting to focus on climate change. And it's been something that I'm passionate about personally and also professionally when we can. And it aligned really well that a lot of the outreach and community events and community ways that we were talking tied into climate and health. And so we realized at our health department, as the state was working on it, or as the State Public Health Association rather was working on it, that this is something that's certainly within public health's field, especially environmental public health. And so then in 2019, our health department created a section for sustainability. There wasn't a lot of training for this when I started. I'm seeing a lot more now, especially in public health master classes, as well as sustainability courses and environmental health. So that's really exciting. And it's really good to see all of those components. Segueing into my current roles and responsibilities, I didn't want to take too long. I have a lot. It's not necessarily completely focused on sustainability and climate change, just due to funding constraints and how we're able to be funded. So my role does include, as Nicole mentioned, solid and infectious waste, lead and healthy homes programs, and nuisance complaints. That's what's in my section. But in terms of climate and sustainability, a lot of what I'm doing right now is focusing on partnerships and building rapport between public health and some of our other partners throughout the county to make sure that we're at that table. Currently, I'm working on a tree canopy mapping project as well as an air quality monitoring project with some partners, and we're looking at native plants as well as a few other outreach community level events, really trying to make sure that we're prepared. And then to Dr. Spoda's point, working on heat responses. We're working with our local emergency management authority as well as our local emergency preparedness team. We had an event last summer and it's probably going to continue to happen. So really looking at that.
Great. Thank you so much, Jenny. Jamie, I'll go to the same question for you. How did you get started working in climate health, and what are your current roles and responsibilities?
Thank you, and good afternoon, everyone. Thanks for inviting us all to speak with you. I work for the Swinomish Indian tribal community. I've been here for 23 years, and Swinomish was one of the first tribes to say that climate change was happening. And so in 2007, the Swinomish Senate, who's the governing body, signed a decree that just said, climate change is here and we're not the cause of it, but we need to adapt. And ever since then, us as staff have been working very actively to think about what the impacts are and what adaptation looks like, specifically me in the context of health writ large and environmental health. Tribes define health differently, many tribes do, including Swinomish. It's more than just physiological impacts. There's connections to community in general, non-human beings, the natural physical worlds. And so at this point, we work on lots and lots of things, but the easiest way for us to explain some of those intangible impacts to health from climate is to think about impacts to Indigenous foods. And so that's the way that we usually try to describe it to people outside of the community. We have a ton of projects, but one of our most exciting ones right now is that we've recently built this past summer the first clam garden, modern day clam garden in the United States. It's an ancient indigenous technology. It comes from First Nations in British Columbia and likely was used all up and down the West Coast. But this is a modern day adaptation to try and think about, one, increase the food sovereignty, but also to address sea level rise, storm surge, and ocean acidification, which are all issues to a very low-lying island reservation in the Pacific Northwest. So thanks.
Great. Thank you so much for that, Jamie. And Red, I will pose the same question to you as well. How did you get started working in climate health? And what are your current roles and responsibilities?
Yeah, for getting started, the short answer is that my supervisor at the time reorganized our office because climate change was one of her passions, and she created a climate and health section. And she said, "Hey, do you want to manage this, or do you want to manage the section you're managing?" And I wanted to manage the climate and health section. And so, and the reason she asked me is because I'd been working in healthy community design and had relationships with like city planners and development. And I think there's a big nexus there between public health and public planning on how you build the environments where people can be healthy as our climate's changing. So that's how I ended up here. And then my current role, I manage and lead a climate and health section. I was just able to hire 2 supervisors. So I actually have some time, and I've spent all my time writing grants because it is an unprecedented grant opportunity with the Inflation Reduction, the IRA, the Inflation Reduction Act. It has there's really a climate change bill, but so responding to all the EPA opportunities that have come up, and trying to sort of get more resources, because climate change has not been funded. I might be getting into future questions, but climate change has not been funded the way that other public health programs have been funded. So you have to be sort of creative and proactive to get the kind of funds you need, because it's big. I mean, it's so big. You talk about just extreme heat, and how long do you need for extreme heat response? Well, I need 20 years for the trees to grow. Just to, that, and then how long is it going to take to replace all the roofs with reflective surfaces, or all the, street cover, all this, all the streets with, it's a long road that's really expensive. And so finding ways to get the funding and to collaborate, because it's never all just going to come through public health, but to collaborate and get that going forward. So we do a lot with air quality, harmful algal blooms, extreme heat, and a lot of petition writing and trying to find funding and manage it.
Great. Thank you, Brad. I will jump back to Jenny. Jenny, why do you feel climate health is an important sector of environmental health?
I think kind of just going off what we've all talked about, it's really more and more impressive and more visible now to see those impacts between climate and health and environmental health, especially as we look at the public health sector. Once we start to see these climate impacts really changing our environmental landscape, that's going to drive down our environmental health specialists or our environmental specialists, depending on what you're going through. And I know historically, a lot of times environmental specialists and environmental workforce was looked at as more of enforcement. And I think we're coming to a really exciting nexus where, yes, we're going to continue to enforce and continue to keep the public safe, but now we get to be in that piece where we're protecting the health long-term versus, catching this or really making sure that restaurants are safe, food is safe, all of that. But now we're looking forward to future generations versus these one, right now. So I just think it's hugely important, and I think it's only going to continue to grow, especially as we find more of these ways and means to address climate change. I'll leave there for.
Great. Thank you so much, Jenny. Jamie, I was going to ask you, what do you feel are the biggest challenges when it comes to climate change?
That's a loaded question. Well, I can respond from the position of a staff member for a small rural indigenous community, which is to say that this is not the community that is really creating the climate to change rapidly. We are not the big producers, but as frontline community is very connected to natural resources in the environment, we feel it absolutely, probably more than the average American does. And so one of the biggest challenges, I think, writ large, is to actually get individuals to understand what their contributions are to climate change, to get them to think about how to change it. I mean, I think that everybody basically said, we need to move away from fossil fuels and coal. Most everybody. But a whole lot of people aren't going to commit to driving their car less. So honestly, I think there's got to be some individual responsibility.
Absolutely, I agree. Rad, I'm going to pose the same question. What have you seen as the biggest challenges when it comes to climate change? Oh, you're on mute.
Rad, you're muted.
Thank you. I would say in addition to individual responsibility, we need society-wide responsibility. So when you look globally, we haven't set, we've set emissions goals, that are to try and be, meet the 1.5 degrees of warming, and we're not going to meet those. Like 1.5 degrees is happening. And then the policies we have passed, we haven't necessarily met those. And so when you're talking about driving a car less is it's not your fault that you live in a city that was designed around cars. So if you want to live in a city that's designed around e-bikes and walking, you need to talk to your city council. And that plan is going to take decades. It's going to take so long, but it's been done. You look at the Netherlands. And they were a car-centric, Amsterdam was a car-centric city in the 70s, and they decided they didn't want to do it, and now they're a bike mecca. And it took them a long time. It took a lot of time, and it took a lot of money, and it took a lot of advocacy. But it wasn't like 1,000 people not deciding not to drive. It was 1,000 people deciding to go and talk to their city governments and organize. There's a great 99% Invisible podcast about the bike advocacy, the Dutch bike advocates, and they had a lot of fun too, which I really liked about them. It wasn't doom and gloom. They did some art together, and they made fun of the politicians, and they were hugely successful. And that was great to see. And I want to be part of that. So I joined the city of my city's planning commission. And we recently just passed some really modest parking reforms, which has been one of my things that I've always wanted to do, because we need to reduce the space we have dedicated to cars and start dedicating that space to people. And so that isn't just good for emissions. It helps people walk, which is healthy. It makes cities more safer, because people don't die from bike and walking collisions, those sorts of things. So I'm a little bit on a soapbox here, but there are a lot of challenges, but I think some of them are around holding not just yourselves accountable, but your leadership accountable. Great. And I work for the government, so hold me accountable too. I'm part of it.
Great, thank you, Rad. Jenny, in your opinion and expertise, how can the environmental health workforce be part of the solution to climate change impacts, and what would it take?
I think for me, the biggest crux of it really is similar to what Rad was talking about a moment ago, is making sure that environmental health workforce is at the table. That's really going to be the first component of it. And realistically and historically, we haven't always been at that table. It's been, some of our planners or some of those other organizations and partnerships, and we haven't always been thought of, again, because of how we've, portrayed ourselves, or how our past has been with what we've done. So I really think the first thing that any upcoming environmental health professional needs to do is be comfortable with sort of inserting yourself in conversations and starting to help people realize that that's what we are here for. We are also here to impact public health in the future, environmental health in the future, and all of this dovetails into climate change initiatives. So I really think that that's probably going to be the biggest component of it. Again, what it's going to take a couple of things. It's going to take individual sort of gumption to go and do it, but then also to push our leadership. I'm not sure, I think Brad may have been in the same position. I'm not sure about Jamie, but sort of forming your own section, saying that this is important, I can lead this, or I'm happy to lead this, and making sure your leadership knows that it's an issue as well. So kind of going both from the outside and the inside, making sure that it's a proponent of it. And I'm so sorry for my screen. I'm not usually on calls this late, and the sun is right there.
No worries. Thank you so much, Jenny, for your answer. Jamie, in your opinion and expertise, how can the environmental health workforce be part of the solution?
I think it's been mentioned a bit before, but I would like to highlight the importance of deconstructing silos. I mean, even thinking about the difference between when people talk about public health and then environmental health. You know, in the community that I work for and in many Indigenous communities, there's no difference. And there's also no difference between, you know, whether I'm at the dental clinic or the medical clinic, or talking about public health or environmental health, or down at the docks with the fishers, or out on the beach with the clam diggers, or with the elders, or anything else. I mean, they're all connected, and we have the luxury of being a small community where everyone knows each other, which has its pluses and minuses, but essentially we can strive to work well together. And I think that that's important even at larger scales, because when things get siloed, the efficacy rate plummets.
Yeah, absolutely. Thank you, Jamie. Rad, can you share a little bit about the different workforce opportunities that environmental health students could pursue that are related to climate and health?
Yeah, so I'll just say, you know, climate and health is still a very new part. Like when I recruit for positions in my climate and health section, I don't think I've ever gotten anybody to apply who had a climate and health background, like zero. So they're all conversion projects, just like I was. And so if you want to work in climate and health, you don't need like, you know, a super deep background, but I'm looking for like people who've demonstrated that they have got that interest, you know, that they've like, you know, done something local on climate change, or done, you know, some projects on climate change, or an internship, just something to show that, like, you know, that's something that drives them, something they're interested in. And but it's growing, you know, in terms of like the positions I see coming open are around like community engagement, you know, environmental justice, and this is in Washington State. I don't know how it is across the nation. Epidemiology. Those are sort of the skill sets that we're looking for in our environmental health group when it comes to opportunities. And I think, you know, like for example, we put in the state budget is on the cusp of being passed, and we asked for some money for climate change, but they added like 3 times as much money. And we don't even know, we're not even totally sure what they expect us to spend it on. And so it's a little bit wild. Like I've never had that kind of experience in public health. You know, I don't think very few people have. And so, yeah, so I think there's a lot of opportunity coming up, and it's also like still forming and norming. So it's not like there aren't like clear cut roles like there are for like, you know, restaurant inspections, where, you know, like there's a system and like there's like, you know, it's pretty structured and functional, whereas climate change is still figuring it out. You know, like Jenny had to figure out what she was going to do in her section. I had to figure out what I was doing in my section, and it's a bunch of people figuring it out, and we're kind of, you know, working towards those best practices. So it's kind of fun in that way, but it's also kind of, you know, you have to be a little bit uncomfortable with uncertainty if you want to work in climate and health.
Great. Well, that must be exciting to get that much additional funding in climate health. That's very awesome.
Well, it hasn't passed yet, fingers crossed.
Jenny, could you share anything different about workforce opportunities where you are?
Yeah, I think there's certainly, in terms of environmental health, I think it is a burgeoning field. We're starting to see more, especially with some of our city partners. One of the things I would advise is be aware that it's hyper local. As we've all talked about, it's part of it really is that environmental justice component. So your disadvantaged and disproportionately impacted communities are going to be a little different depending on where you are. And then also the climate impacts and the issues you're going to face are going to be different. So if you're looking to stay in a certain area, kind of learn some of those or learn what that is. But in terms of the workforce development, I think just making yourself in that conversation and trying to take those courses as you come. I know for us, if you came and again, if you had a passion for climate change and also grant writing, I think that's, especially as environmental health specialists, that's just going to continue to get bigger and bigger with the funding coming down. I know all of us are in a little bit of workforce pinches. You know, we don't have enough staff for a lot of things. So writing grants is becoming almost a full-time job. So I think that that's also a way to increase your desirability for a location.
Absolutely. Thank you, Jenny. Looks like we're getting to the end of the hour. I want to open up the questions from the audience. So if you have a question for any of our panelists, please drop it into the Q&A box and I will ask it for you. It looks like we have a question for Jamie. It says, I work with a small tribe in Alaska on the road system, and one of our greatest impacts we think will be climate migration as people moving in and out. Have you encountered mental health issues around climate change, and especially around more people and pressure on the land?
100%. Yes. There's a lot of information out there. I'm happy to share it. You're welcome to contact me. Nicole can share my email address in the chat if you want. There are Indigenous specific ways of thinking about mental health impacts. There are also non-Indigenous specific ways of thinking about it, but climate migration definitely 100% has mental health impacts for both the people that have to move and for the people who are receiving the people that have to move, for a variety of reasons. I just want to put in a quick plug. Working for a tribe is also an amazing thing to do. We have Rad and Jenny, who are two great people who work for government agencies, but I can also tell you that working for a sovereign nation gives you a lot of flexibility, and also being a grant writer, yeah, something you got to do here too.
Great, thank you, Jamie, very much. And let's see, Jenny, it looks like what do you wish for environmental health students to take away from this seminar?
I think just what we've sort of reiterated, not to, I guess, pigeonhole yourself in one item, or if you specifically want to work on climate change, which I think is great, make sure you're taking either additional courses or looking to see what else is out there, because as it continues to change, we're going to be able to bring more and more of those backgrounds into the public health fold. So I think just follow what interests you, and that passion will show through when you're looking for the workforce and when you're entering the workforce. And that's going to be how you start your careers.
Great. If anyone else has any questions, please drop them into the Q&A box. Give it another moment. Rad, I'm going to pose that same question to you. What would you like for students today to take away from this?
I think that just that if you're interested in working in climate change and health, there's a lot of pathways. There's a lot of pathways to it, and there's a lot of states that don't have climate specific health programming yet, but there are like informal groups that are meeting to talk about climate change, or a few like local health folks meeting to talk about data for climate change. And it's sort of like coming to, so like there's lots of opportunities to start like getting involved. And I think there's a lot of opportunity for those to blossom, because I think in like 10, 20 years, like you're going to see a lot more climate positions. I don't think you would be, I think there's a lot of opportunity, and there's going to be more opportunity. So I think you would have like some job security, for better or for worse, if you like wanted to focus on climate change. And also that it's a small community, and reach out, like you can email me if you want to ask about climate change. And I'm sure there's others that are interested in it as well. because we're all kind of in this together, trying to set it up and like make it happen. So I think it's good to like build a community around it.
Great, thank you so much. We're going to go ahead and move on. We have 2 minutes left. So this year, NEHA is hosting our 86th annual educational conference in New Orleans, Louisiana, on July 31st through August 3rd. The theme is Raise the Voice of Your Environmental Health Workforce. The AEC provides a unique opportunity to network with hundreds of environmental health professionals and those just beginning their careers in environmental health. You can find more details at neha.org/AEC. Let me share that there are 2 AEC keynote speakers this year. One, Dr. Maureen Lichtfield, she's Dean and Professor for the School of Public Health at Jonas Salk, and retired Lieutenant General Russell Honore, who held the role of commander of the Joint Task Force during Hurricane Katrina. I would like to thank our speaker, Dr. Amir Sepkoda, and our panelists, Jenny McAdams, Dr. Jamie Donatuto, and Rad Cunningham, for partnering with NEHA and providing great content to all of our attendees today. And thank you all for attending today's seminar on the impacts of climate change. Please complete the evaluation for today's seminar. You will receive a link to the survey after the seminar ends. We would greatly appreciate your feedback, your comments, and recommendations. And please feel free to contact us anytime by visiting our website or emailing us at support@neha.org. And thank you again. We hope you enjoy the rest of your day.